Jewel, were you supposed to go live or I was supposed to start the live? Okay. Cool.
Hey, how are you, Corey?
I'm good. How are you?
I'm good. Happy Friday, y'all.
Yes, it's a beautiful day, so I was like, I want to be outside for this live. I hope it's not too loud. Can you hear me good?
I can hear you. Yeah.
Okay, good. Okay, great. We're just waiting for Whitman. I didn't know. I was like, I didn't know if I was supposed to go live or you were. So we're good. Okay, perfect. Okay, Whitman-Walker's here.
Hey, Paul.
Hey, Paul.
Hello.
Happy Friday.
Yes, happy.
Cool. We can
All
get
right.
started. Hi, everyone.
Yep,
My
yep.
name is Rachel, and I use she, hers pronouns. And during the past few months, Whitman-Walker's Community Health Department has been expanding its outreach to include the social media platform. We cover various topics from STIs and HIV to sexual health practices to social determinants of health to ways to access your care and just general public health interventions. The community health team is here to educate and support you.
Hello, everybody. My name is Corey Haskett, and I use he, him, his pronouns. So, some facts about STDs. STDs are infections that are spread from one person to another, usually during vaginal, anal, or oral sex. They are really common, and lots of people who have them don't have any symptoms. Without treatment, STDs can lead to serious health problems. The good news is that getting tested is no big deal, and most STDs are easy to treat. But the possibility of infections and disease are as much part of sex as it is fun. Both men and women get them, even if you didn't realize it. You probably had an STD. Knowledge is power, and when it comes to your sexual health, recognizing the symptoms is a start. But you won't always notice chlamydia, gonorrhea, herpes, or any other STDs. You'll need to get tested to protect yourself and your partner. Fortunately, all these common STDs can be treated and most be cured.
Thanks for that, Corey. Yeah, we're talking about
You're
all the
welcome.
common STIs and STDs that you might come in contact with if you're living a sexually active life. So yeah, one of the most common ones is HPV or human papillomavirus. Nearly every sexually active person will have HPV at some point in their life. It is the most common sexually transmitted infection in the US, and more than 40 types of HPV can be spread sexually. You can get them through vaginal or front hole, anal or oral sex, and you can get them by skin-to-skin contact too. Most types of HPV have no symptoms and cause no harm, and your body gets rid of them on its own. But some of them cause genital warts. Others infect the mouth and the throat, and still others can cause cancer of the cervix, penis, mouth, or throat. There are 3 vaccines that exist, Syphilis, Gardasil, and Gardasil 9. They all protect against these cancers. Gardasil and Gardasil 9 also protect against genital warts, vaginal or frontal cancer, and anal cancer. The CDC recommends young women and men ages 11 to 26, or young people ages 11 to 26 to get vaccinated for HPV. The HPV vaccine is also approved for people up to 45 years old. Talk to your provider to see if it is the right choice for you, and the pap smear can also show most cervical cancers caused by HPV early on. I'm proud to say that I got my 3 Gardasil shots before I turned 26, and so I always feel really good about that protection that I have against HPV. Another common STI is chlamydia. It's also the most commonly reported STD in the US. It's spread mostly by vaginal or front hole or anal sex, but you can get it through oral sex as well. Sometimes you'll notice an odd discharge from your vagina or front hole or penis, or pain and burning when you're peeing, but only about 25% of women and 50% of men get symptoms. Chlamydia is caused by bacteria, so it's treated by antibiotics. And after you're treated, you should get retested in 1 to 3 months. So even if your partner has been treated, definitely you want to get retested and check with your doctor about when to get tested again to make sure the infection is completely gone.
So another common STI is gonorrhea. Gonorrhea is another common bacterial STD. People often get it with chlamydia, and the symptoms are similar: usual discharge from the vagina or front hole or penis, or pain and burning when you pee. Most men with gonorrhea get symptoms, but only 20% of women or people assigned women at birth um, do. Gonorrhea is easily treated with antibiotics. Syphilis. Syphilis is a tricky disease with 4 stages. In the primary stage, the main symptom is a sore. Sometimes syphilis is called a great imitator because the sore can look like a cut or ingrown hair or a harmless bump. The secondary stage starts with a rash on your body, followed by sores in your mouth, vagina or front hole, and or anus. Symptoms usually disappear in the third or the latent stage. This stage can last for years or the rest of your life. Only about 15% of the people with untreated syphilis will develop the final stage. In the last stage, it causes organ and nerve damage. It also can cause problems in your brain. Your doctor can give you an antibiotic to treat syphilis. The earlier it's treated, the fewer antibiotics you'll need to get the work done quickly.
Fun fact about syphilis, it's what killed Al Capone. The next STI we've got up is herpes. So both strains of the herpes virus, HSV1 and HSV2, can cause genital herpes, but usually the culprit is HSV2. The main symptom of herpes is painful blisters around the penis, vagina or front hole, or anus, but you might get blisters inside your vagina or front hole or anus where you can't see or feel them. Not everyone who has herpes gets blisters. Herpes is really easy to catch. All it takes is skin-to-skin contact, including areas that the condom does not cover. So you're most contagious when you have blisters, but you don't need to pass them. But you don't need them to pass the virus along to others. You can pass herpes along to folks even if you don't have blisters currently. Because herpes is a virus, you can't cure it, but you can take medication to manage it. Next up, we've got trichomoniasis, also affectionately known as trich. More women than men get trichomoniasis, which is caused by a tiny parasite. People can give trichomoniasis to each other through penis and vagina or front hole contact, and women can give it to each other when their genital areas touch. Only about 30% of people with trichomoniasis have symptoms including itching, burning, or sore genitals. You might also see a smelly, clear, white, yellowish, or greenish discharge. Trichomoniasis is treated with antibiotics, and it is important to be retested within 3 months of treatment, even if your partner has also been treated.
So HIV and AIDS. HIV is the virus that causes AIDS. It's passed through bodies fluids like blood, semen, vaginal, front hole fluids, and breast milk. You can get it by having vaginal or front hole and anal intercourse with an infected person without a condom or sharing a needle with someone who is infected. You can't get HIV from saliva or by kissing. Symptoms of HIV are vague. They can come to you like a flu, muscle ache, fatigue, or a slight fever. You can also lose weight or have diarrhea. The only sure way to tell if you have been infected with HIV is to get your saliva or blood tested. HIV can take years to destroy your immune system past a certain point. Your body loses its ability to fight off infections. There's no cure for HIV, but powerful drugs can help people with HIV live longer.
Thank you. That's it for us today for common STIs and STDs. But before we go, we want to give you a few reminders about COVID-19 and vaccines. If you've already gotten your COVID-19 vaccine, congratulations. You've taken really big and important steps to help prevent yourself, your loved ones, and your community from getting sick. Variants continue to soar across the world in the US, and it's totally understandable if you might want to keep wearing your mask as the vaccine isn't 100% effective and more contagious variants continue to spread. But that said, please stay alert. The vaccine doesn't prevent new cases of COVID-19, but it does help to prevent severe illness, hospitalization, and death if you were to get infected with COVID. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has a COVID-19 vaccine available, and everyone ages 12 and up is available or eligible to get a COVID-19 vaccine. Please call us at 202-207-2480 to make a COVID-19 vaccine appointment. Again, that number is 202-207-2480. If you're a DC resident looking to get a COVID-19 vaccine, please visit vaccinate.dc.gov or call 1-855-363-0333. Again, that's 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. Again, that's 1-855-634-6829. And if you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. Again, that's 1-877-829-4682. If you haven't been vaccinated against COVID-19 and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, social distancing, and the like. It's very important that you get the vaccine and discuss any COVID precautionary measures with those around you, but be mindful of mask and keeping your distance from folks, especially when you do not know whether or not they've been vaccinated. Please remember to follow our team on Instagram, Facebook, and Twitter at Whitman-Walker, and check our website for the latest information on our services at www.whitman-walker.org. And please follow along with our team as well at RealTalkDC _ and at NoFilterDC. And if you need any resources or information, or you want to schedule an HIV or STI testing appointment, you can call our team at the number in the comments. It's 202-797-4439. Again, that's 202-797-4439. Thank you all so much, and have a great rest of your Friday.